Hello and welcome to my channel. My name is Enorita James. I'm a clinical research scientist of over 22 years experience. Today I'm going to be talking about the different kinds of laboratory tests that you can do to diagnose what I called pre-diabetic state. Most times people think of diabetes, but there's something you can do to actually let you know if you are going to be diabetic. And that for me is much better because in my channel, I always advocate prevention being better than cure. I don't think you will want to be living on insulin injections for your life. So that is why this video is very important. It's a video that gives you information that has to do with your health. If you don't know what diabetes is, I have a video that I did explaining exactly what diabetes is, telling you what insulin is, explaining the relationship between insulin and diabetes, between insulin and glucose. I will link the video, I think somewhere there or towards the end of this video, so that you can go and listen to it before you come back and listen to this one. Now, what is prediabetes? A pre-diabetic state is a state where your blood glucose level is a little bit elevated, but not high enough for one to say that you're diabetic. And most times, a lot of people are in a pre-diabetic stage for many years, and they're not even aware of it. If only they can become aware of it, it can stop them from becoming diabetic, especially type 2 diabetes. If you don't know what type 2 diabetes is, I also have a video that I talked about the different kinds of diabetes. So, what tests can you carry out to help you know that you are in a pre-diabetic state? There are, I think, 4 different kinds of tests that you can carry out to actually let your doctor know that you are in a pre-diabetic state. And I'm going to list the 4 tests, and I'm going to talk about them one by one. The first one is the fasting blood glucose test or fasting blood sugar test. Most times it is called FBS. You see your doctor writing FBS, it's a fasting blood sugar test. The second one is the HbA1c test. HbA1c test. The third one is the insulin test. And of course, the last one is OGTT. OGTT stands for oral glucose tolerance test. So those are the 4 major tests that I will advise you to try and be doing as a routine test, especially if you are somebody whose eating habits is very high on carbohydrates. If you take a lot of carbohydrate, if you take a lot of snacks on the road, you don't have time to eat, especially people that live in the US, they don't have time to cook a good meal and all that. Please do yourself a favor and go and do these 4 tests at least once every 4 months. At least once every 4 months. It can save you a lot of stress in terms of treatment. So now let me start. What is a fasting blood sugar test? A fasting blood sugar test is your glucose level measured in your blood after you stayed away from food from 8 to 12 hours. So most times when you go to your physician and they want to send you for a fasting blood sugar test, they will tell you the time to eat your last meal the day before the test. So that by the time you're going for the test the next morning, you would have fasted for at least 8 to 12 hours. And when you get there, your blood is normally collected, and sometimes your urine too is collected to do the test. The normal fasting blood sugar level should be less than 100 milligrams per day. That is the normal acceptable fasting blood sugar test. And the reason that they do a fasting blood sugar test is because when you eat, there's normally a spike of glucose in your system for a few hours before insulin works on it. So most times a fasting blood sugar test is a better deal. And that is why most physicians send you for a fasting blood sugar test. The next test to actually check if you are in a pre-diabetic state is the HbA1c test. HbA1c sometimes can be called hemoglobin A1c or glycated hemoglobin. So if you see any of these things, if your physician writes any of this test for you, you know that it's the same thing, glycated hemoglobin, HbA1c or A1c test or hemoglobin A1c. So any of those four is for this test. Now this test is so important because the test shows how your blood has managed glucose for the past 3 months. And most times it is measured in percentages. That is why it is so important, this particular test. So if you go to a physician and you want to do a fasting blood sugar, please request for an HbA1c test. Because that is probably tell you better. It's a better deal to let you know, okay, how has my body been managing glucose for the past 3 months? And that is what HbA1c test will tell you. The normal range for your HbA1c should be less than 5.7%. If you have a result that is less than 5.7%, it simply means your sugar is maybe around 117 milligrams per dl or 6.5 millimoles per liter. If your HbA1c is about 5.7 to maybe 6.4%, that is a signal for you to know that you're probably pre-diabetic. And this is so important because your sugar could be normal. It could still be normal. It could still be under 100. And then your HbA1c is above 5.7%. That is a very, very good warning for you to start controlling your diet. That is why HbA1c is so important. So please, the next time you go to do your medical checkup, request not just for a fasting blood sugar, but for an HbA1c. Most times, physicians will not request for it because most times they use the results to actually test if the diabetic management that they are using for their patient is actually working well. So that's what it's primarily used for in the hospitals. But it is also good to do it to know whether you're in a pre-diabetic state. So most times the doctors will not send you. That is why you should request. And that is why you're listening to this video of information. You request for an HbA1c. Believe me, it will save you a lot. The next test of the 4 tests I'm going to talk about today is the insulin test. If you do not know what insulin is, I have a video that I talked about exactly what insulin is, how insulin regulates the glucose in the body, where insulin is produced from, and what insulin actually does for the sugar in our body or the glucose in our bodies. An insulin test is normally done from your blood. Blood is normally drawn from your vein for an insulin test. And most times it also involves fasting for 8 to 12 hours before you do it. Why would you do an insulin test? A lot of emphasis is placed on sugar test. But the problem is before your sugar gets high, you would have had insulin resistance for many years. So by the time somebody runs an insulin test in your blood and they see that your insulin is quite high, higher than normal, and your sugar test is still showing normal, that is a warning sign. Of course, there are a lot of other things that can increase insulin. That is why it is best interpreted by physicians by running a sugar test and an insulin test. Not just an insulin test. They run the two to be able to give a diagnosis. But most times, physicians do not send you for an insulin test. So please, have this information at the back of your mind. An insulin test is a very simple test that it can be done in the blood. Sometimes you can even do it by yourself. You can buy an insulin pack and check it by yourself. It is so important because most pre-diabetic stages will end up in type 2 diabetes. But if you can check it by this test that I've told you, a fasting blood sugar test, HbA1c test, and insulin test, and the next one I'm going to talk about, the OGTT test. So please, do your insulin test to actually find out what is the level. The last test I'm going to be talking about is the OGTT, the oral glucose tolerance test. Now, in this test, you also do it in a fasting state. And the test actually shows how your body handles glucose per time. It is different from the HbA1c test. The HbA1c test shows how your blood handles glucose for the past 3 months. The oral glucose tolerance test actually tells you, for instance, if you take a carbohydrate meal now, is it possible for your sugar level to go back to the fasting level after about 2.5 to 3 hours, which should normally be the case? So the test normally involves, we are giving you a dose of glucose, sometimes 75 milligrams glucose dissolved in water. You take it in, and then we collect your blood samples at intervals of 30 minutes, and your urine samples too at intervals of about 1 hour. And so we plot a graph. There's a normal weight that is supposed to show in that graph if you have a normal glucose tolerance curve. So this will let your physician know if your body is handling your glucose very well per time whenever you take in carbohydrate meals. So that is what the oral glucose tolerance test is all about. So those are the 4 tests I want you to do whenever you're going for a medical checkup. Your fasting blood sugar test, insulin test, HbA1c test, and the oral glucose tolerance test. Believe me, if you can be doing this at least once every 4 months, it will help you to learn how to regulate your diet, because the best way to prevent diabetes actually is regulation of your diet, especially type 1 diabetics. Thank you so much for listening. In my next video, I'm going to be talking about the kind of food you can eat to actually regulate your sugar levels. See you in my next video.